We're back for day 3 with another edition of Sound Bites of the 27th ASGCT annual meeting here in Baltimore. I'm Lynnea Olivarez, incoming chair of ASGCT's Communications Committee, and I'm privileged to bring you insights from Dr. Lindsey George, 10-year assistant professor of pediatrics and hematology at the University of Pennsylvania's Perelman School of Medicine. She's also the director of clinical in vivo gene therapy and an attending physician in the Division of Hematology at CHOP. Dr. George is a past recipient of ASGCT's Outstanding New Investigator Award and is known for her pioneering work as the lead PI for several early-stage hemophilia A and B gene therapy clinical trials, including one that only last week became FDA approved. Congratulations. Today at the annual meeting, she presented on lessons learned from clinical efficacy and safety of CGTs. So thank you for joining us, Dr. George. For those of us who missed your session, what would you say is your top advice for investigators and sponsors just starting to enter the clinic?
That's a tough question. Well, it's very exciting. Of course, in hemophilia gene therapy, we now have 3 choices of licensed products, 1 for Hem A and 2 for Hem B. I think what I would say for people that are going to be thinking about prescribing these drugs is it's the devil's in the details of this work. And so I think, really kind of diving into the data, because, this is really a once-in-a-lifetime decision that patients are making. So I think that the gravity of that, deserves quite a lot of effort in exchange with patients. And I actually have found, as just a plug for this, the data in many of the trials, because they evolve over time, has come out of multiple papers. For those, I actually have found so far the FDA summary basis for regulatory actions to be a very comprehensive review of the data. So is quite helpful if somebody is looking for a comprehensive, important clinical trial data.
Okay, good to keep in mind. There's a lot of excitement around the application of CGTs for diseases in larger populations, moving beyond rare diseases. How do you see these early lessons from the hemophilia trials you ran being applied to studies for more common disorders?
Oh, that's a good question. Well, I think, of course, the hemophilia trials have been used to adeno-associated viral vectors, or AAV vectors. I think actually a lot of those early lessons might have predated my work on this, but really I think what's come out of the hemophilia work is an understanding of the AAV immunological response, some of the regulatory framework, certainly AAV manufacturing. Hemophilia has long been this monogenic disorder for the development of gene-based therapies, so some of that certainly predates my own involvement in this work, but I think that I think the culmination is very exciting, obviously, and I hope that the hemophilias continue to lead the way in the development of gene-based therapies and incorporating potentially novel technologies and novel approaches.
And your lab's work continues as part of CHOP's Novel Therapeutics for Bleeding Disorders, or Not Bleeding Frontier program. This includes understanding the mechanistic basis of questions that have emerged from current hemophilia gene therapy clinical trials and general AAV studies. What are some of the specific issues you're looking into?
Oh, thank you for asking about the lab. So we are, in particular, we're interested in factor VIII biochemistry, as well as in understanding some of the translational questions that have come out, in particular in hemophilia A trials. And I think one of the principal questions is this durability of factor VIII expression. Briefly, the currently licensed product for hemophilia A has seen this year-over-year decline, and that was replicated so far anyways in a trial being sponsored by Pfizer. But a number of clinical trials have had demonstrated durable low-level factor VIII expression, and we presented some of this data today to look at potential mechanistic basis of this. And what I showed really was that it looks like mice may recapitulate what we're seeing in people, and we're trying to mechanistically understand this. So we have some data to suggest that this decline in factor VIII levels may be due to loss of vector copy number. So why you lose these vector copy numbers is unclear and to be continued. Hopefully we can work on this a bit more and understand it.
Yeah, maybe next year you'll have an answer for us. And finally, how do you see your role as an attending physician evolving over the coming years when it comes to meeting with and developing treatment plans for hemophilia patients, given the major changes to available therapies?
Yeah, it's a great thing, I think, for hemophilia patients because they have several novel therapeutic approaches, and I think what may be a bit daunting sometimes for patients is really understanding comprehensively what these therapies mean and what's the right decision for them. And so that is certainly one avenue, which is just communicating with families and with patients the therapies that are available and trying to come up with an individualized treatment plan. What I've actually found in my role in the hemophilia gene therapy trials is actually I've been able to be helpful to people outside of hematologists, because many clinical specialties are using AAV vectors, and so I think the hematologists in many ways have had a couple decades of experience with AAV vectors, and of course still have other clinical groups. But what I find myself day to day on the clinical side being, hopefully most helpful anyways, is people that are new to using AAV vectors, and so they can understand how, what the vectors are, some of the observations out of clinical trial to understand them. And so honestly, I think it's really, for the hemophilia side, it's really helping families and patients understand what's available, what we know and what we don't know. And then the other clinical side is sort of taking lessons learned in hemophilia, as you mentioned earlier, and applying that around AAV vectors for other disorders outside of hemophilia.
So that seems to be a theme we're hearing from other folks too on the Soundbite series, the importance of collaboration, communication with the patient communities, education, transparency. So all good stuff. Well, thank you, Dr. George, for your time, and stay tuned for more work for coming out of her lab in the future and for other Soundbites coming your way today.